LifeNet Health, saving lives, restoring health. Breast reconstruction, burns, chronic wounds, soft tissue repair, dental and sports medicine procedures, among other traumas, pose great challenges for physicians, from infection to scarring and related complications. Traditionally, skin allografts have been provided to physicians with donor cells, which can limit its reparative potential and possibly cause an inflammatory reaction. Successful use of skin-derived allografts hinges critically on the ability to render the tissue acellular, that is, removing most of the donor cells from the tissue, which provides an ideal scaffold for recipient-mediated repair and thus successful surgical outcomes in multiple soft tissue applications. LifeNet Health's Matricell decellularization technology represents an exciting new paradigm shift for allograft bioimplants. The proprietary Matricell process is unique in its ability to quickly and reliably produce decellularized allograft tissue while retaining the native biomechanical strength. Matricell uses a detergent treatment and or a recombinant endonuclease, which, unlike other decellularization methods that use bovine-derived endonucleases, poses no risk of prion disease transmission. Major histocompatibility complex molecules, Langerhans cells, and keratinocytes are removed through the patented process. The resultant decellularized matrix is made up of native collagen bundles, elastin strands, and proteoglycans. Isotonic saline rinses out cellular components and removes the decellularization reagents. The allograft is bathed in a LifeNet Health proprietary USP glycerol solution. This preservation agent is a naturally occurring molecule and acts as a water replacement agent, enabling convenient room temperature storage, allowing the product to be used immediately without rinsing, rehydration, or thawing. The final step is sterilization with low-dose gamma irradiation at dry ice temperatures, which results in a sterility assurance level of 10 to the -6, while maintaining the biomechanical integrity of the tissue. Decellularized dermis with Matricell technology offers a native scaffold for the recipient's natural healing response to proceed. Easy to use and biocompatible, the allograft can be applied inside the wound and secured with sutures, staples, or steri-strips. As shown in a wound application, this flexible allograft consists of collagen, elastin, proteoglycans, and vascular channels that provide a sturdy scaffold for cell ingrowth. Recipient cellular ingrowth leads to repopulation of the dermal scaffold. Capillaries appear and fibroblasts migrate to the innermost part of the wound. Keratinocytes migrate from the recipient tissue to aid in healing. Decellularized dermis with Matricell technology provides a flexible matrix through which the recipient cells can migrate, proliferate, and differentiate into appropriate cell types. Sterile. Terminal irradiation renders a sterility assurance level of 10 to the -6. Matricell technology removes greater than or equal to 97% of donor cells and genetic material. Unlike alternative materials, peer-reviewed literature states that decellularized dermis is more resistant to infection. All of this is achieved while maintaining desirable biomechanical properties. Several other advantages distinguish LifeNet Health decellularized dermis from competing products. Matricell does not impact the inherent strength of the tissue. Suture retention and tensile strengths are not affected by the decellularization process. Matricell decellularized dermis is stored at room temperature. No rinsing, rehydration, or extra setup time is required, so it's always available and ready to use. Matricell, the future of allograft bioimplant decellularization.